Thank you so much, Tawana. Well, this morning we have another special guest. We have Dr. Jimmy Miller of the Greenwood Leflore Hospital. Welcome, Dr. Miller.
Thank you.
Now, Dr. Miller, you're here this morning, a part of May National Stroke Awareness Prevention Month.
Correct.
And so we just wanted to talk a little bit to you this morning about stroke, some of the things that are associated with it, and how to prevent it. But let's start with one thing. There's two main types of strokes, correct? Would you tell us about it?
The ischemic stroke is the most common. That's what most people think about when they say stroke. And there the blood supply is cut off to part of the brain, so that brain tissue will tend to die off. The other is a hemorrhagic stroke, usually related to hypertension. And there a blood vessel bursts and it bleeds into the brain. On occasion it's a tumor or vascular malformation, some other cause, but usually it's hypertension. But the two main types are the ischemic and the hemorrhagic.
Now, when the big thing that we're really seeking is to make sure people are aware and know their options when they have something like this. You were telling us earlier, there's surgical ways to really treat this. What are some surgical ways that you guys attack this?
The surgeon is involved. It's more to help control pressure inside the head. If a person comes in with a stroke and it's a large stroke, then the neurosurgeon can take off part of the skull and help relieve pressure inside the head. It does not change the deficit from the stroke, but it may save a life. On occasion, there are some strokes that tend to swell up and block the spinal fluid pathways. Spinal fluid is made inside the brain, flows through cavities that are in the brain, and if the connections between the cavities is knocked off so that the fluid cannot flow, then the cavities above will tend to balloon up, get larger.
Right.
We can put a tube into there to help drain some of the fluid out and relieve some of the pressure. And on occasion, if there's a bleed in the brain, we can take out some of the blood.
And the biggest issue is that pressure that built up around the brain, correct?
That's correct.
Now, do you treat the ischemic, did I say it right? Ischemic and the hemorrhagic the same way, or do you have different procedures for both?
The ischemic is usually treated with a craniectomy, where we remove part of the skull to relieve the pressure.
Okay.
The hemorrhagic, it depends on the size of the blood clot inside the brain and where it's located. Some are surgically accessible, and we can take out part of the clot. We take out just enough to help relieve the pressure, and we don't try to take all of it out. The brain tissue around is not in the best shape, and so we try not to disturb it because it may cause further bleeding and swelling.
Now, with stroke, are there, we talked last week about ways you can recognize stroke, that you're having a stroke and what to do. But I'm just curious, are there things that people need to watch right now, to kind of prevent whatever ways they can to prevent having a stroke?
It's usually common sense kind of things. Stop smoking. Smoking is bad for both types of strokes. Adequate exercise is always useful for the brain, and maintaining a normal blood pressure throughout life. A lot of the problems are accumulation of years of having blood pressure just gradually creeping up on the person. So those kind of things really help.
Fantastic, fantastic. Dr. Miller, thank you so much for being here.
Thank you.
We really appreciate it. This has been a part of our May Stroke Awareness Month. We've got more. We're coming back to Mr. Loris in just a little bit, but right now we're going to take a break.
This Defeat Diabetes segment is brought to you by Greenwood Leflore Hospital.